Good evening, everybody. I'm Dr. Kathy Bendixson. I'm the Counseling Department Chair and 504 Coordinator here at York High School. And we're very excited to be partnering with the Elmhurst Commission on Youth and bringing you this panel discussion tonight to talk about high-risk behaviors and supports that are available. So I'm going to pass this off to Jackie, who is going to get us started tonight and moderate this evening. Thank you.
Thank you, Kathy. Good evening. Thank you all for attending tonight. Like Kathy said, my name is Jackie. I chair the City of Elmhurst Commission on Youth. We are excited that this is our first in-person event since pre-pandemic, and we were able to make this happen tonight due to the wonderful partnership with York High School and District 205. Specifically, I'd like to thank Dr. Shaheh Bagdasarian, York's principal, for opening the doors to the community for this important evening. When the Youth Commission came to him, he was truly dedicated to the kids and wanted to make this happen, knowing that this is an important topic. Also, thank you to Meredith Sheriff, Assistant Principal of Student Services, for working together with the Commission to bring you this evening. Our events wouldn't be possible without the entire work of our Youth Commission in Elmhurst. They are listed in the back of the program, but some are here with us tonight. We have Ann Zimmer, Sheila Wright, and Kim Brigman, so thank you. A special thank you to Joe and Dan for bringing this event live this evening for the Elmhurst YouTube channel. Joe was instrumental in filming multiple virtual events live through last year for the Youth Commission. Thank you, Joe. The City of Elmhurst, Mayor Levin, and the City Council realizes the hardship COVID has had on youth in town, and I'd like to thank them for their continued support on bringing programs of need to this community. Much of our mission includes mental health, as many issues are on the rise this past year. We will continue to bring Elmhurst valuable programming. Tonight we are honored to have the following panelists with us. They will each begin the evening with a brief presentation and then a follow-up Q&A session to follow. We have Terry Finley, who's a social worker at York, Colleen Papia, with Pathlight Behavioral Health, Eating Recovery Center, Mark Talbot, also a counselor at York, Allison Tate with Pathlight Eating Recovery Center, and Matthew Quinn, who is here with Rosecrans. Thank you guys for being here. Why don't we go ahead and start? We can go ahead and start and just go ahead down the line if you guys want to introduce and give some information about what you've all seen over the past year and just kind of some areas that you want to make the community aware. Thank you.
I think that means we're starting, Colleen. So I'm Allison. I've worked with Eating Recovery Center for about 3 years now, and very confidently can say the last year has been the most acute year for us with eating disorders and co-occurring disorders. And I think if I had to name a couple of the reasons or explanations as to why that would be, I think with the COVID pandemic and the upheaval of any sort of consistency or stability for our kids, that has really resulted in the need for a way of coping and managing all of these internal things that have been going on for these kids. I think also, obviously, there's a lot of social media concerns going on, especially with the things happening around Facebook and Instagram. I think that's also been a really big, important factor with the increase in acuity.
I think also to add to what Allison was saying is the increase in, I don't know, increase is the right word, but the dependency on social media because of the social isolation and the pandemic. So a lot of adolescents have turned to social media more to like connect with people. Sorry, Michael. So people or adolescents have turned more to like social media to try to connect with people. So that kind of puts more of that emphasis on the materials out there that, you know, can negatively influence them. Allison had mentioned that we're seeing a higher acuity, and that is definitely true. We're seeing a lot of co-occurring disorders. So we have, you know, the adolescents that are coming in, and at ERC, primarily their diagnosis or their primary diagnosis is an eating disorder. However, we are also seeing that there's an increase in depression, anxiety, self-harm. And so some of the times that these behaviors will start at home, whether, with the pandemic of like isolation and depression, and if it is self-harm and that kind of, what's the word I'm looking for? Like interchanges, I don't know, with the eating disorder. So that's when Allison says that we're seeing a higher acuity. I think the cases that we are getting are a little bit more complicated because it's not that we're coming in and just treating one thing.
Oftentimes, oh man, I have not used a mic in such a long time. I often give the analogy to parents of your kid is taking in all of this stimuli from the external world, and they can either be a free-flowing, just taking it in, processing it, and letting it go, and over time, things can build up, and it can be genetic vulnerability factors, it can be social vulnerability factors, family dynamic vulnerability factors that stack up and eventually block the ability to process all of the external stimuli coming in. And the kid has two options. They can either kind of implode or explode. And we see a lot of the behaviors like self-harm and eating disorders serving as a way to release some of that pressure while it's not addressing the problem or the thing that caused the inability to process through all the external stimuli. And so we really think about these behaviors as serving a function of coping, and we always think about what is your kid possibly coping with. And I think this last year has really brought a lot to our attention about what kids are coping with, not only because of the pandemic and because of social media, but also really highlights that there's a lot going on for our kids these days that we may not necessarily see until it gets to a point of, we're turning to X, Y, or Z behaviors.
And I can just, I'm going to take my mask on just to make sure that you guys can hear me. I can just speak from the school perspective. We are absolutely, we have far more students this semester hospitalized or in mental health programs than we ever have, and I think that just speaks to kind of where these kids are right now. And we can't underestimate, they were essentially isolated for a long time. And so to bring them back into this very busy, very stimulating building has been extremely hard. I think a lot of kids kind of forgot their coping strategies, right? And, whether it's an issue with a friend in a class, they didn't have to deal with any of that when they were at home. And so I think they're just not used to it, and they kind of go from 0 to 10. I think that's what we've seen a lot of, is that they just become so overwhelmed that they kind of can't take those steps that they probably used to do. Additionally, an 8-hour school day, 8 periods a day, 50 minutes each, is really taxing when you're not used to doing that. I think kids got very, very comfortable at home. And so I think that's added to the stress. I know teachers did their absolute best last year, but the academics weren't the same. It wasn't the same, and I don't think we can say that it was. And so the expectations academically are higher, and I also think that is really adding a lot to the stress, especially we've got a lot of high-achieving students in this building. Did you want to add to that, Mark?
Yeah, I think, we look at the comorbidity of stressors, and like Allison and like Colleen mentioned, it's social media, it's other outside influences, it's peer conflicts, peer situations that they're having to navigate, in addition to a whole other list of things that happen in the community and here at school. It just sort of right now is like that perfect storm of a scenario where students have a lot of stressors and they don't have as much recent experience with how to navigate those established coping skills and established coping strategies that they might have been able to use and access in the pre-pandemic. So we're seeing kind of like a lot of different factors run in, and we're trying to navigate those while also helping students where they're at right now, but also reminding them that they've had issues before, they've shown strength in those other situations, and that the goal is to get them through this challenging time.
I'm going to speak a little bit about the substance use piece in all this. First, I want to thank Jackie. Jackie always reaches out to me for these types of events. I've done several in Elmhurst, and I always have to embarrass Jackie because we graduated high school together. And the funny thing is we're not the only graduates here. We got Tom, who came up and introduced himself a little bit ago. I can even remember, just as a quick aside, I don't know if you remember this, Jackie, but I can remember like almost exactly where I would sit in here in the larger assemblies, and I would always sit right over there. So it's just funny kind of anytime I'm back in this school, I'm kind of proud to be back here representing a former York graduate, so thanks for having me. So yeah, to add on to what everybody else is saying, working for Rosecrans, we specialize in mental health, but really a lot of our specialty is in substance use. That's a lot of my background working for Rosecrans and working in private practice at this point. And certainly we've seen big jumps in anxiety, big jumps in depression, those types of things that everybody else has spoken about. But what's really interesting with substance use is it's kind of really the definition of good news, bad news that I've seen and that we've seen as an organization when it comes to substance use. It's not all bad, to be quite honest with you, because if you really think about it, it makes sense that for kids that maybe would have, over the past year and a half, maybe started to experiment with alcohol, or, before the pandemic, I was doing presentation after presentation on vaping and legalization of marijuana and all those types of things. You have a lot of kids out there that were inside for a year and a half, weren't in other kids' basements. They weren't at parties. They didn't have the exposure and that peer pressure. So you have a lot of kids that maybe would have started to experiment that didn't. Now, that's not to say that some of the anxieties from COVID and other issues like depression, those still happen at an alarming rate. But you do have a lot of kids that over the past year and a half didn't start to experiment with drugs and alcohol because they were stuck inside. So when it comes to substance use, there is kind of a mixed bag. Now, the bad news in that is that the kids that were already starting down that path, were already starting to drink, were already starting to vape, use marijuana, they found ways to still do it, and if anything, do it more. They got creative. COVID didn't just shut them down for the past year and a half. They used their social media to get connects to drop stuff off in their mailbox, meet them down, hey, mom and dad, I gotta go for a walk. They'll walk down the street and pick it up. And they were using even more because they had so much time. They would use during the school day, shut the camera off for a second and use. It was so much easier for them to be discreet about it because they were at home so much. And so there was this kind of evolving cycle with them of, and usually in those situations, they're self-medicating some type of underlying depression or anxiety. And so those conditions continue to get worse and worse and worse. The substance use. So we saw kids that it almost like was two paths, either a complete drop-off in our early intervention services, or kids that were immediately needing really severe, needing residential level, recovery home level, and not a lot in between. So it's really fascinating how that's evolved. Now I think as the world returns to normal, unfortunately, I think kids are going to be in situations where they can start to experiment again and it all kind of blend together. But I think it's noteworthy that it's been kind of this dual track of kids really staying away from it. And I don't know if you guys have noticed that in your work at all. Or kids that are really, really in bad shape with their mental health and their substance use because they have found a way to really just kind of dive into it. Either their parents kind of are unaware of it or they've turned a blind eye to it, but we haven't had the Terry Finleys. We haven't had over the past year and a half, the interactions that we usually have with the deans, the social workers, the guidance counselors, because the ability to intervene and interact and engage, right, has been so difficult, up until this year because the kids are at home. So all of those things, the alcohol at the homecoming games and kids bringing the vapes to school, all of those things we've seen a big, at Rosecrans, over the past year and a half, a big drop off in school referrals, understandably, but that's a big resource for us. So we're trying to figure out ways to really connect with these families and these parents more directly, and it's been difficult. So in a lot of ways, with school being back in session, we've seen a big uptick in referrals, because now social workers and other people, our school staff, are able to re-engage with those families. And I think it's probably been surprising in terms of what you're seeing and being like, holy cow, this has really gotten out of hand, whether it's a mental health issue or a substance issue. So I just wanted to kind of give you a little bit of that, the Rosecrans angle, the substance use angle, to add on to what everybody else is saying.
And I will say, and Allison can also speak to this, I don't know why I had to say that, but Allison can also speak to this. What I will say to Matt's point is we are seeing, I don't know that, we said like we've seen the trends go up, we've seen acuity go up. For a large portion of our population, they're perfectionists, and they care a lot about school. So not being in school worked as a stressor. Because it was their way of feeling a sense of control. It was their way of feeling, this external validation of I'm good enough. And so not having school, I think, it increased more stress for some of our patients. And I don't know if you have anything to add to that, but she works with, perfectionists. But.
Yeah, we all work with perfectionists to some degree, but on a self-control spectrum, there's the kiddos who are kind of more under-controlled, who just kind of chronic impulsivity or emotion, like they wear their heart on their sleeves, kind of how they're feeling. They'll ask for help when they're struggling. And then we have the other end of the spectrum where we have the perfectionists who are going to internalize everything. They want that A, they have a low sense of reward, and so getting school taken away then takes away that sense of accomplishment, and now how do I become good enough? And the eating disorder and self-injury even can serve as a way of self-punishment, or as a way of I'm achieving something, I'm moving towards a goal. More so with the eating disorder, and then failure to meet a goal, then we can see that turning to self-injury. And that's on the kind of more over-controlled side of the spectrum. On the more under-controlled side of the spectrum, we see the eating disorder or self-injury as a way to feel something, as a way to kind of understand the stimuli that I'm experiencing and feeling, and being in some sort of control of it.
And I think across the board, what we're all saying is that COVID kind of gave adolescents an opportunity to avoid. And I think that's some of the struggle with like reintegrating. Shoot, I just lost my point. It gave an opportunity for people to avoid, and I don't know what I was going to say after that. If I remember, I'll throw it in.
Well, I'll add to that while Colleen tries to remember what she was going to say. I asked so in the Chicagoland area, we have three Rosecrans. We have three primary adolescent IOPs in the suburban locations. And knowing I was going to do this tonight, because I don't do the direct clinical adolescent work for Rosecrans, I asked them and I reached out just to try to get some feedback on some of this stuff. And aside from what I've mentioned already, the term that came up multiple times is this idea of role confusion, and the idea of kids coming out of this because they've been so disconnected. I think Colleen remembered her point. Just in terms of coming back into this world, not really, think of an adolescent who, for older folks like older folks, but like for people like us, a year and a half, but for somebody in high school, that's like a lifetime, So a lot of kids are coming back with just kind of these role confusion, self-esteem, who am I? It's, teenage years are hard enough to figure out who you are, but I think it's made it like super amplified because of all this.
At the high school level, we definitely can echo that, in that high school, especially for our freshman students, is already a huge transition. What we've noticed is that our freshmen, what we're seeing in terms of behaviors and in just general attitude, they feel like seventh graders. And I don't say that as a bad thing, it's just they didn't have that period of socialization to pick up on stuff. So our school, in many ways, is full of freshmen this year. The only class that's had a full normal year is our seniors, and that was when they were freshmen. Sophomores, juniors, freshmen, and the current freshmen have never been in this building for a full year in what we would call normal times. And we're seeing some of those impacts of that. And then when we look at like how do we intervene and how do we build relationships with students, what we're finding is that we are playing a massive game of catch up, and that students don't have those established connections with their trusted adults and with their teachers in schools, and we are having to accelerate that process while also trying to build support. And a great example of that is, like a couple days ago, a junior emailed me, wanted to come down and had an issue, and they did the exact right thing. They advocated for themselves and they wanted to reach out and seek out support. And I said, sure, come on down to YSS or York Student Services. And they asked, where is that? And that's not a question we would typically get from a junior, because we would normally say, it's junior year, you should know where Student Services is. But that student had never been into Student Services in person before. I think that just speaks to the environmental impact that students are reaching out for help, at least in the school setting, but they don't always know physically where to go or who to reach out to. So we're trying to reestablish those connections while also reinforcing those outside in the community as well.
Yeah, I would absolutely agree. So I think in addition to the mental health issues, we're definitely seeing a maturity behavior issues as well. Really, I think freshmen, sophomore, and juniors, our current freshman class didn't have that opportunity as 8th graders, to be the big man on campus, right? And to sort of own that and behave in such a way we're the older kids. They really, I think, developmentally, they kind of missed a lot. And we are which has been a very interesting thing, I think, because, we were all really prepared for the mental health stuff. But just the really immature kind of behaviors are definitely there. And again, the impulse control, because I think a lot of kids have forgotten how to do school, by no fault of their own. And so, we're definitely seeing, the deans are very busy, I will say that, this semester so far.
One thing I want to add too, and this is a little bit different than what we've been talking about, but I have a unique perspective, like I'm sure some of you have. I have 3 kids, elementary school and now a middle schooler, which is scary to think about. I have a teenager now. But seeing it from the perspective of just watching them start the school year in person this year, it was really striking to me just to see the level of anxiety come out that I never see, just because they haven't had the practice, and so all of those skills that kids will just, the anxieties that don't build up because day after day they're able to practice those skills, right? They just built up over a year and a half, and so it was really kind of wow, that was one of the most striking moments of this whole thing in terms of the impact with my own kids, is seeing just the tears and just the level of stress that it was palpable those first couple of weeks of school. I just felt like that was something worth mentioning.
You guys kind of led me back around to what I forgot that I was going to say. I think some of the stuff that we're talking about isn't abnormal, right? Like a 8th grader going into freshman is probably most likely always going to be somewhat anxious about starting high school. Social media is always going to be somewhat of an influence. There's always going to be, a kid who gets offered drugs or alcohol or whatever it may be in high school. And by them not being in school, they might have missed out on some of those things, but they also missed out on all of the positive things that sometimes balances that, right? So the idea of if I feel good about school or if I feel connected to my friends, then if I'm offered, a substance, maybe it's easier for me to say no. Or if I have a difficult emotion, maybe it's easier for me to talk to a friend because I feel connected with them. So I don't know any of the issues that came up, over the last year were these brand new things, but I think it's the balance of kids were struggling with the same stuff and we took away, and I think it speaks to the emotional, social emotional development and the importance of this stage of life for them, because I think we took away some of that would have helped them learn coping for some of these other things that we're seeing now an increase in.
Okay, I'm just going to chime in here, and I admit I kind of zoned out because I became a parent for a second here, and I just want to say I really appreciate you guys being up here having this conversation, and I can just tell as this got started, watching all of you just really reflect on what the past year has done as not just professionals but as parents as well. I know that one of the questions that always comes up is, okay, so we're talking about what's happened, and what as parents or as a community can we do, right? And I know that's a pretty generalized question. What can we do, right? But, we talked about, you guys, I was taking some notes here, and we talked about the higher acuity, right? And the disconnection, the impulse control, the immature behavior, and, it's painful to see in our kids. So as parents or as a community, I know the schools have been very active in working on this as well, but what can we do? What can parents do to support our kids and to help connect to where we need to connect and so forth?
I think one of the biggest things is just, and fortunately I see it with my middle schooler and some of her friends and other kids, is really just talking about normalizing. And fortunately, I think you're seeing some positive developments in this regard in the media. You have, Simone Biles and what happened to her in the Olympics, and just really normalizing and destigmatizing, just talking about how, I feel like it used to be going to a counselor or a therapist was, something, that you're abnormal or something's wrong with you, versus being able to go to see a counselor because what you're experiencing, given what has happened, is totally to be expected. And you should feel more anxious. You potentially should feel more down. You've missed prom. You've missed all of those things. It's just normalizing that, getting help and destigmatizing that whole process.
Yeah, I totally agree with you. I think as parents, you guys know your kids best, right? We all do. And so if you're noticing or seeing, hearing things that just, behaviors, comments, whatever it might be, that just feel off, your instinct is saying something just doesn't seem right. Start somewhere, right? And just, obviously I'm here at York, but the counselors and social workers and psychologists here at York are a great place to start, to just kind of talk through what you're seeing. We can give you referrals for, outside counselors. We can meet with your student, with your permission, to just kind of assess what might be going on. So just trust your instinct and absolutely normalize that. Being a teenager is never easy, but I think it's definitely harder now in many ways, as we've all said. And in my office, I hear so many kids say that they're terrified that their parents are going to be disappointed in them. And I have 3 children of my own, and it's not because of anything that we do, but I think that that's in their head, right? That they just want everyone to be proud of them. So that normalizing and just, being there for them and knowing that it's a safe space to be purely open and honest, I think is such a relief, for kids. So I would say that's a great place to start, and I think, Mark, you had a great.
Yeah, I think the way to, if you're going to take, from my perspective, you're going to take one thing tonight, it's talk to your kids. And the way I say that, and it can probably come off as people up on the stage telling you to talk to your kids, especially from a school setting, like duh. But I think the reason we want to practice those communications with our students and with our children is you want to make hard conversations, not easy, just less hard, and you want to have kind of like those train tracks and those foundations for communication established. So instead of waiting for something to get to the point where you're Googling Rosecrans or you're looking at stuff, if you've had that conversation before you get to that critical point and you've practiced that with your child, and they may be adolescents, they may be difficult to talk to, because then they probably will be, but you got to help them practice that communication skill, especially after the last year and a half, where the easiest communication skill and strategy that they had was to close the Chromebook and go up into their room and kind of shut down from the world. So I think reinforcing those communication patterns in our students and in that adolescent population is a great thing to do yesterday, the day before that, but every day moving forward, to help make those hard conversations a little bit less hard when you get into those moments.
And I swore I had a great answer, and apparently they said everything that I was going to say. So I'm just going to echo some of that, and I know Allison's dying too. But so yes, the communication piece of it. And just to point out that I think it's more about having an open conversation and understanding the teen's experience versus coming in and trying to problem solve. Because a lot of the times as a parent, we want to take away our child's distress or pain, right? So they come and they're like, I'm anxious about school. And we're like, you're great and you're wonderful. Instead of just saying like, yeah, man, that sucks. I get that, right? And so what that does is it helps the teen feel validated, and then it opens up more of, this is a safe space for me to talk. I'm not going to feel judged. My parent's not going to disappoint me. So to just add the communication piece of it, if sometimes it's not about problem solving or fixing the discomfort, it's just creating a space for them to talk. And then the other part of it, which they kind of said, of also not being fearful of having these conversations. Parents, it's their own fears and anxiety of sometimes of why I don't want to ask about this, or right, like I don't want to say the word self-harm because that might put the idea in their head. They've heard it. So the idea of feeling comfortable with having these conversations and not letting your fear or your anxiety get in the way. And then the third point, which they kind of also said, of like remembering that you're a role model for them, right? So if I want my kid to talk about emotion, let me start using emotion words around the house. If I want my kid to start coping, let me demonstrate those coping skills. And especially right now, if they are struggling with re-engaging and those social connections, you might be the primary social outlet or connection they have. So remembering that you are a role model for them.
And Colleen took everything I was going to say. I think it also goes back to the maturity piece. Adolescents, prior to COVID and all of that, were very good at indirect communication. And I think so much more so we're seeing kids communicate their emotions in a covert way that amongst all of our stresses as caregivers, and I can imagine as parents, that it's so easily missed, the more covert emotional statements. And I think it's really leaning into, okay, you don't want to go to school. What emotion might be driving the statements of, oh, I don't want to go to school, and really trying to put yourself in their shoes and hear them and validate them. Not necessarily because you agree, but because you want to connect with your kiddo and you want to be able to say, I am that safe space for you. Let's continue and open up this conversation. And then really practicing those direct conversational skills so that then they can be more open and overt with their emotional experiences and feel more comfortable coming to you.
And one practical way that, and this might seem obvious, but I want to say it anyway, from a panel presentation like this is, think about the 2, 3, 4, 5 things that are takeaways for you or things that you thought were noteworthy. And just going back and starting the conversation with them, say, hey, I went to this presentation and I thought it was interesting that they mentioned this, or I thought it was interesting. Do you, not like, does this happen to you, but like, do you ever notice with any of your friends or anybody else at school, do you think that, are you seeing that? And all of a sudden they start to kind of meander it back to, if you're really listening, and really empathizing, it'll circle back to them. So that's just kind of a very straightforward and an easy way to kind of start to navigate that conversation, kind of building off of an event like this.
And just to build off of that, I see a lot of teenagers really dislike being told what to do or how they're feeling. And so as a caregiver, taking a very curious, non-judgmental stance and just asking, not telling, and opening up from that sort of inquisitive position.
You had talked, Colleen, about the word self-injury, how it's not a scary word, they've heard about it. For self-injury or any sort of eating issues or body image that has been increasing lately, many times by the time the parent finds out, it's, I had no idea. And of course, there's the depression, the anxiety, and some other stuff going on. What could be helpful for parents to maybe find out before here we are sitting in an ER, or here we are sitting at a therapist office or behavioral health center? Like what could parents do to start that conversation or to be more aware that there could be something more going on?
I was going to say, I don't know that that's directly to me because anyone can answer, but I think it kind of echoes what we were just saying of being mindful of changes in the child's behavior, and if, like Allison said, approaching that with curiosity. Like, I see that you've been, isolating more, or hanging out in your room more. What's going on? What's that about? If it is that they are coming to you, especially if they fall into that category of where there's someone who's a little bit more over-controlled and doesn't talk, if they do come to you, set down your cell phone, turn off the TV, be present in that moment. And I get that that's really hard for us to do sometimes, especially if we have other kids and jobs, right? Like, to just be like, I'm going to drop everything in this moment. But if we notice that our teen is not the person to typically come and talk to us, then really making sure that we have that space and that time for them. But I would say the biggest thing is, like I said, just being mindful and approaching it with curiosity. And sometimes even asking about, like, and this is still curiosity, but even like, hey, have you seen those articles, about Facebook? Or so not even saying that, okay, we're talking about you, like, do you relate to any of this? But we're just saying we're having a conversation about, like, these world trends.
And I know some of this is vague and ambiguous, and that might be frustrating as a caregiver. You're like, I want to know exactly what I'm looking for. And the reality is all teenagers and all of these kind of co-occurring disorders are really sneaky and ambiguous, and they can be really hard to detect. And I think one of the places, especially just thinking about eating disorders in general, is looking at it from a systemic lens and looking at where is the pervasive diet culture seeping into my child's life, or just the everyday life, the ads on the radio, the ads on the TV, MyFitnessPal, different things in the grocery store. And so if you notice maybe an increase in your kiddo's awareness of those things, being mindful as a parent of how just those things embedded in society might be impacting a kid who is very much observing and taking in the world and drawing conclusions from what they're seeing in just like external society, and then thinking about, how does it show up in the home? How does it show up in my kid? And there's obviously, markers that we say, if your kid's isolating more, if they're not talking to you, if they're wearing long sleeves or wearing sweats, or they're, insistent or more rigid on their food and behaviors. And those would be like typical warning signs. But I think if we're going to look at it from a more systemic lens, and like a community-oriented lens, we have to look at what are the ways in which I myself or the society around me really endorses some of these behaviors that might lead to school refusal, self-injury, substance use, eating disorders.
The other thing I wanted to ask is, and I'm sure everyone can probably speak to this, but many times a parent doesn't know where to go, right? They discover something, they either think their pediatrician, ER, call the school. But there's so many different levels of care, and right, as a therapist, many times they come in and you start educating them on all the places they can go, and it doesn't have to be all or nothing. Can you guys speak to maybe even for York, when a parent, can they come to you and you would lead them to where they need to go? What it would be like to go to a center, and what happens from there? How do they get an assessment? Do they have to go to the ER? But just the different levels of care from, I think a lot of parents think, oh gosh, if I take my kid, they're going straight to residential. And there's so many options, like with day programs, they get their school at the day programs, and maybe you start with an individual therapist. But if you guys can maybe speak to that so parents know what that looks like. Thank you.
Yeah, I mean, it's a really, it's a challenging area to navigate, right? Because, most are not sort of professionals in the field, and it's overwhelming. There are so many different levels and so many different, therapists and counselors and programs, and it can just be really hard to boil it all down. So, I think, again, reaching out to your school social worker counselor is a great place to start. And then depending on sort of what that level is, it can be recommended. Obviously if a student is, talking about harming themselves, that would be an ER visit. that would be going to like a Linden Oaks to have an evaluation done, and then they can determine like the level of care, whether that's an inpatient facility, a partial hospitalization program, or an intensive outpatient. Those are sort of the three levels when you're talking about kind of that severity. You know, if things are just kind of starting and evolving and you're noticing some things, you know, an outside therapist would be a great place to start as well if there's no sort of imminent risk. Talking to friends, right, you know, whose kids may have experienced something and they know of a great therapist that worked really well with their child. You know, it's the idea of like, just don't be embarrassed, you know, it's because so many kids are struggling. And so, you know, other friends and parents are a great resource. But it is, you know, I think a lot of times people do kind of need some direction. You know, at York, we have anxiety groups that we run. You know, we have a variety of different things that we offer just to kind of be, because kids are at school, you know, for a long time during the day, so we kind of have access to them. So, you know, just kind of starting somewhere and asking questions, I think is a great place to start.
I will add to that, because parents do it a lot, and I'm going to say don't do it, is like Google, right? Because like I can type in a couple words and be like, oh my God, my child has this super severe disorder. So the idea of like stay off the internet, don't Google. School's a great place to start. I think that's one of the like best things about being a counselor I found as I've developed through my career, is that like we have a great relationship with the schools, and so it even helps with the adolescent of like, you like your social worker knows this counselor, I'm going to be more open to going to them. So don't Google is all I wanted to say.
And certainly, as you'd imagine, representing Rosecrans, if there is that concerning substance use piece, we offer evaluations, phone, in office, video, so if there is that piece, because that's a specialty area for us, that we would certainly encourage that as a great starting point. Even though in a lot of ways we're kind of known for our residential services, we have all levels of care for outpatient, intensive outpatient, all of those different lanes. And aside from that, because I also see clients in private practice, I'll get calls from parents, texts from parents, emails from parents where it's not even substance use related, and they're just looking for an outpatient therapist that specializes in eating disorders or anxiety or grief and loss, all of these things. And so, I'm certainly, myself, I'm always willing to be a resource for parents in that area as well.
I think a key thing to sort of think about is when you're sort of navigating that and looking for that roadmap from a school perspective, we definitely can sort of help with that. Just trying to figure out what that level of support and what that setting of support might look like. But I think another kind of what Matt was alluding to is school-based resources and community-based resources. We work kind of hand in hand with students. So for us in the school setting, it's not uncommon to get a phone call if we have consent and we have that release of information from the therapist so that we can connect and help support that student across all domains. And I think that something like that would happen where, like as you were alluding to, if we know of a community-based resource that would be a good fit, we would recommend that. And other community-based resources are going to do that based on the student's individual need. That figuring it out is such an individualized process for each student and their specific situation that I don't think there's a place or a setting that can solve every single thing. And so as a mental health field, we are, I think, pretty good about referring and recognizing where our areas of strength are, and then how we can help connect that student with the best resource for them at that moment.
Okay, I think I'm going to open up for some questions from everybody. Is anybody here have a question for? Yes. Start right here.
My name is Richard Rosenberg. I am the chairman of the youth committee for the Kiwanis Club of Elmhurst. We have been very much involved in York High School in programs of feeding children who did not have money to come in for lunch. We support the music programs in several cases, And we have now for 3 years searched for a way to support a communication skill where children can reach out to a professional via phone, confidentiality, and have not been able to do that. We've offered monies, we've offered input into it. We worked with the old superintendent of schools. There's got to be a way that we as a community, as a charitable community, whether it's Rotary or Lions Clubs or Kiwanis, that we could support a way that a child in stress could call and confidentiality have an opportunity to talk to someone other than parent and say, I am in a stressful situation. I'm considering harm, I'm considering life-ending circumstances, whatever they are. Is there not a way, is there not a program, is there not an opportunity for us to financially support a program like this with tens of thousands of dollars to make this work? There's got to be some place we can help.
Thank you, Mr. Rosenberg. Well, let's start with, does anyone know of any service where there's some peer help or anything like that close by in town or surrounding in DuPage? Yes, we have.
So there is a crisis text line that is supposed to be on, or I think it's going to be at some point, on the back of every student's ID that indicates where they can text if they're in a crisis, not a crisis situation, but they're wanting to talk to somebody or to communicate about an issue. I know they have this in Naperville. They have a program called Kids Matter, and they really promote it there. And I believe the Glenbard schools are doing it as well. And my understanding is that it was going to be on all of the student IDs. I'm assuming it's not right now.
We don't know.
Okay.
We are, I guess, confident enough to admit where, and that sounds like a really great opportunity. I believe we've heard something along those lines. What I can say is, and Mr. Rosenberg, like you mentioned, sometimes students need that shield of confidentiality to reach out. I will say that one system we do already have in Elmhurst District 205 would be the Quick Tip system, which allows students to anonymously report concerns about other people. But it also is it's an avenue for students to, in some ways, recognize that they need help and to reach out. And that triggers a next level of intervention from a student services member. And depending on if it's a student safety concern or a student social emotional concern, we do have that avenue for a student to report and sort of indicate concern about another student. But I think you bring up a really good point of that is potentially a need in our community.
There was a program 3 years ago that a student could call in, and it was done in Rockford or a northern suburb of this area of Illinois. And it was a program where 24/7 confidentiality, and a student could call in. It wasn't the suicide number. It wasn't that, but you got a counselor. You got someone like yourselves who would answer that phone and would talk to that child. That program almost got started. It seemed to work, but it died because of it ran out of emphasis. There was nobody pushing it. There was no one for example, in this case, the superintendent and I worked diligently trying to make it put together. It never happened. There are programs like that, I think, that are professionally, they're for pay, where we would support those, and maybe school budgets would as well. But it's got to be directed at kids. It's got to be as somebody who could answer questions. It's got to be somebody who will hold confidentiality, where the confidentiality is only broken in case of self-infliction or in suicide circumstances. But there's got to be somebody out there doing this. Can we find that person? We'll support it.
Thank you. I think the idea is excellent, and let's talk too. Okay? Okay, perfect. Thank you, Mr. Rosenberg. Do you guys have anything else before I pass on? Any other? Did you want to say something else? Yeah.
So you were talking about the different connections that you would make for parents if their child was struggling, but the reality is there's not enough mental health professionals to address the great need So what can be done in the interim between the time a parent might be able to make an appointment with a therapist and, it could be months. So what, as a school, as a community, what kind of resources can be provided during that gap?
That's a great question, and you're absolutely right. Oops, sorry, we're hearing so many, just wait lists just are crazy. So that's why we've really, we've obviously recognized the need, and we have, I think, at least 4 anxiety groups running right now. And that can be, students, we sort of just, the student has self-identified, and so we've plugged them into the group. I mean, obviously, parent consent is part of this process, or parent calls, and the student really we're not aware of, but, we call the student down and talk about the group, and kind of get their buy-in. And again, social workers, we can see students kind of in the interim. I mean, certainly we do see students that have like IEPs and have, social work minutes each week, but half of my day or week is with, sort of what we call general education students or gen ed students who are just going through a rough time. So we can kind of be that interim, and it's not just social workers, it's psychologists, counselors, it's all of us in student services can kind of be that, that middle ground when needed. But we're open, I mean, because again, things are evolving so fast, we're trying to kind of respond to the need as effectively and quickly, as we can. Does that answer your question?
Coming over.
My question is, we talked a lot tonight about all these issues are happening because of COVID, but a lot of this anxiety and depression started before it. We know that it is because of social media. Are you projecting, and I know nobody has a crystal ball here, but are a lot of these kids going to outgrow this, or do you think that this is going to be the trend? And what are ways then that we can do to, continue to make them more self-aware so maybe they can outgrow some of this? I don't know. Do you outgrow anxiety? Do you outgrow depression? Do you outgrow eating disorder? Do you outgrow, because when I was growing up, and I grew up in the district too, not everybody had these kind of issues. So just any insight would be, or your thoughts, I'd appreciate. Thanks.
And I think yes, I don't know what the question is, but yes. No, I know what the question is. The idea of it's not necessarily about outgrowing it, it's about teaching how to cope. So if it is that I can learn to cope with life, because, and not so much depression, but where if it's anxiety, if it's eating disorders, if it's self-harm, it is a way for the child to cope. It's an ineffective way. So the outgrowing it is really about that we're teaching them to cope. And we're teaching them to manage life. And that is something that can be learned, and then it is something that they can continue to, do into their adulthood and be healthier and, happier as a result. As Allison said way in the beginning tonight, there is sometimes a genetic piece to this, right? So it might be that if I have a genetic predisposition to an impulse control disorder or to depression or anxiety, then it might be that I need more maintenance if it's medication or that piece of it. But I think it's really about teaching coping. Is the outgrowing that you're talking about.
And, as a parent, and I see this with my 3 kids, and sometimes it plays out this way and sometimes it doesn't, is just making sure, you mentioned social media. I think that's a huge thing. Are we as parents actively relegating time on social media, time on screens? I know it's so easy where I'm looking at my phone and I'm not, and they're on their phones. I think so much of it is modeling. Are we engaged? Are we on screens? It's not only developing skills and finding ways to cope, but also making sure that as a family, our habits are healthy as much as possible. Healthy lifestyle, exercise, eating, all of these things that as parents that we're doing everything we can to try to build these habits, because you mentioned the term, will they grow out of it? I think if we're really trying hard to instill and model and structure these healthy habits, then yes. But if they continue to be on social media, on their phones, 10 hours a day, or whatever the case may be, then there's less of a chance of them outgrowing it. And I know that sounds like an obvious answer, but I think the best you can do is try to provide some of the healthy structure, build those skills, and build that into the everyday life.
The phrase that I use, and I think a lot of us, in the field use, is what we want is our kids to be comfortable being uncomfortable. And what I mean by that is, I think with the internet and social media, there's an immediacy, right? Where that generation, this is my theory, hasn't really learned to kind of sit with their feelings, right? And it is in those moments that you learn, I will get through this. This will pass. And with, texting and, just the Googling, and it's just also immediate that the minute I feel like, a kid gets uncomfortable or upset, they want it to go away. They want it to stop. And so I think the more that we can, again, that normalizing that, it's okay to be upset. It's okay to be upset this whole evening, right? We don't have to fix it. We don't have to make it better right away, because that's preventing them from learning the skills, whatever they are for them. And we're all different in that way, but learning how to manage sitting with those uncomfortable feelings. And I think that that's a really big struggle that kids have. I think about if I had an argument with my girlfriend, I had to sit all weekend long. I didn't have that immediate, and I think that's a large difference in this generation. Again, that's just kind of my theory.
I think going off of that, you asked, clearly students in the 21st century were having to navigate a really different world through their phones, through their social interactions before COVID. And COVID added certainly a lot of other additional stressors on that. But your original point was yes, the things that we're seeing are not exclusively because of the current state of the world, or they are just not because of the current state of the pandemic. Like Terry said, we want students to be more comfortable and more resilient in those uncomfortable moments. And I think a goal for that is not to say they are not going to have any social media or any access to those stressors, but how can they access those 21st century resources and components of everyday life in a healthy, manageable way. And I think a big thing that students and adolescents are sometimes struggling with is the ease of access, and that allows for it's so easy to check Instagram or to check Snapchat, and they don't have that experience. They don't have that practice, like Matt said, of sitting down and decompressing. And I think if they practice a little bit more mindfulness in their everyday lives, they're going to become more effective and more responsible digital citizens, which are going to in turn help them increase their everyday coping skills.
Hello. I have a question because we're all talking about how much therapy our kids need and how much problem solving we're trying to work for the kids, and I appreciate all that, but I was curious if there's ever going to be a class or something that we could teach our children on how to cope with the new social media, and everybody is talking about mental health, but it's just such a broad expansion. It's not if you have an eating disorder, you have a mental health problem, or if you have a drug problem. It's just the kids are a little confused, and so are the parents, because everybody's just focusing on mental health, but they're not really teaching any of us, unless it's through therapy or with the social worker or in a traumatic situation with your child. They're not really. No one's really gearing our children up for being able to deal with everyday stuff. So is there a class that they're going to be putting together, or I don't know. It's have you ever heard of the outward bound stuff? I feel like that maybe our community needs to do a little bit more of that outward bound. Is there anything in the works for that?
Here at York, or in the school district, or just in the community?
She said
In the school district. I can just speak for York in terms of like we, social workers push into classes to talk about, how to deal with stress, mindfulness techniques, all of those things. So we do, because there's really no benefit if we just talk about it. We have to teach kids, right? We have to teach them, and then hopefully they can practice it. So, we go into FOG classes. The counselors definitely, that's part of their FOG curriculum. SEL is becoming, a definite hotspot this year. Teachers are being asked to implement, different activities or lessons that are related to that social emotional learning, and all of that comes under that umbrella of teaching kids how to deal before it becomes a crisis or before it becomes, a bigger situation. Did that answer your question?
From all this mental health problems that all of our youth is having, and also the adults are having because the youth is having so much mental health problems, is there ever going to be, like, for lack of idea of it, like a camp or other than like a club with school, but something that is actually, instead of going to group therapy, is actually going to be a class to teach, like a preventive class?
A preventive class? I'm not aware of anything yet at this point. Again, we do lunch and learns. We do as much as we can in terms of, like, it's hard as a school because, we're trying to balance that academic piece, and then, a lot of parents don't want their kids pulled out of class and things like that. But as far as I know, there's no class per se. It's a great idea, though. Almost like home ec, but for more like life skills and life ec and, just social media and how to be a digital citizen, all of those things. I think it's a great idea.
I will say, speaking specifically to York, our freshmen do get two experiences similar to what you're talking about, in that they do cover and go over some in depth in several ways mental health in their health classes. So there's a whole unit dedicated towards mental health where students are asked to unpack some of the issues that we're talking about. And we talk about mental health, and mental health is a continuum. This whole topic has been about the negative impact, the negative side of mental health. But there's a lot of there's positive aspects of mental health, just like you can go to your doctor and be perfectly healthy, not just go to your doctor when you have the cold or you have the flu. So I would say that health really does dive into kind of that continuum of mental health, where it is a daily practice to, just like as you eat salad or you go to the gym to work on your physical health, you need to embody and practice those skills on a daily basis to work on the mental health component as well. Like Terry mentioned, FOG, or Freshman Orientation and Guidance, is that freshman orientation program where mindfulness components are incorporated, and the goal of that is to help our freshman students specifically feel a little bit more rooted in the York community as they transition to this much larger, much bigger school environment, which comes with a lot of challenges, but we try to help them see the really big or large amount of opportunities that are also available to them. So I'd say that those two experiences for freshmen specifically at York are good opportunities to sort of practice that, but I think everyone on the podium here or at the podium talking would say that it's never bad to have more opportunities for students to work on those mindfulness skills, both in classroom settings, but also in the community and in their just everyday lives.
But I think it's hard to come up with an easy answer for that question, as you can see, because the reality of it is that there's a lot of room for improvement, and I think this is a larger kind of cultural issue within schools, that there's too much of a focus on academics relative to social and emotional wellness, that makes it hard to come up with an easy answer because there's tons of room for improvement here. And I wanted to point that out to validate your question because it makes for a difficult answer.
And I was gonna, say that in the same thing of where the schools right now and even the mental health community, like we're still very kind of like reactive to what happened. And as we've talked about wait lists and things like that, where we're somewhat, overwhelmed with that. But I think if there's a positive to take it away from COVID, so many kids were like, I miss school, right? Like they used to hate it and now they're like, I just want to go back. So I think that there's stuff to be learned, both from the pandemic, the transition back in, and I think there's a huge opportunity here for the schools, for the mental health field to make some adjustments, but I think we're still in that period of time of we're reacting to what we're seeing. And the schools have done, they've done a lot of work with, even trying to mask policies and stuff like that. So I think they did a lot to prepare for it, but I still think that there's, opportunities to expand from.
Based on what we're talking about, what about for parents? I feel like what she's talking about, but maybe something to help the parents get involved and learn how to deal with this stuff. Does that make sense?
Yeah, so I think what you're kind of getting at is parent outreach. And I think what that looks like in the current landscape is reaching out to your student support team and just starting to have those conversations. Our biggest goal is to, when we work with parents about students, but just in general, we want to help strengthen those relationships between the family and the home, the school, and then in those cases, we want to be able to support those conversations and communication channels if and when a student does start to access community-based supports. So I would say for right now, as a new parent, I have a ton of questions, and it's definitely an opportunity to start having that conversation by reaching out and starting that open dialogue. And if we can't provide that outreach, we can't answer those questions, we're going to do our best to get you in contact with someone or a community organization that can help address that sort of outreach need.
Anyone else? Thank you. Can you speak to how, as a parent, we navigate the line between leniency and empathy? So, whether or not our kids are looking to us for structure and rules, or, as a parent, we're also giving great leniency because of everything they've been through. So I guess I'm looking for some advice on what that line is. What are our kids looking for from us?
I think, and Allison might have something to say, but I think kids overall, they won't admit it, but they want rules. They want to know what parents' expectations are. They want to please, no matter who the adolescent or however they present. So I think it's helpful for parents to know, and that kind of goes along with some of the discomfort of a teen might push back on it, but it really does. It gives them guidance if those rules and expectations are there. As far as with the leniency piece of it, trust, right? Good, consistent behavior over time. The idea of if we're going to be more lenient, that should be something that the teen we have trust in them. And we build that trust once again because we give them these expectations. We see that they can handle these responsibilities and meet those expectations. And as we feel more comfortable, we're going to back off and that leniency is naturally going to happen.
And I think it's important to have it trickle down. I know this sounds like a very grand statement, but just have it trickle down from the values that you as a parent, or if it's a dual parent household, that are the key values for you, and then align your rules and structure around those, right? And then certainly providing accountability and structure with those rules, but then empathizing everywhere else. And validating and listening and walking a mile. Any cliche that you want to speak to that talks about empathizing or validating, do that as much as possible within the structure of, value guided, respect, honesty, responsibility, all of those things, okay, then use those and then maybe write out what are the 15 or 20, 10 rules that follow along those lines. And then everything else aside from that structure should just be support.
I think going off that idea of support, which is super important, is especially adolescents, they don't love saying it, but they benefit from structure, but they benefit from clearly explained, and if they feel like they're a stakeholder in that process. So as you're building those expectations and communicating that with them, explain the why, and I think explain the larger context, like Matt was saying. Like, if you have a house rule or a curfew, for instance, explain that it's about those values of safety, and it's about those values of trust. And this is not going to be a miracle answer. They're not all of a sudden going to magically love every single rule and expectation that you set. They are teenagers after all. But if they know the why, they may disagree, but I think they're going to feel a lot more empowered and validated in that conversation, where you're going to, in my experience working with adolescents, where you see conflicts is where a rule or an expectation or a consequence is thrown at them without explanation and without any of those validating practices. That's when they really struggle with that. So I would say to your original question of leniency versus structure, I would say almost like a compassionate structure or an empathetic structure, where you clearly communicate what the rules are and what you expect from them, but then know that they are going to make mistakes. They are going to not follow through 100% of the time, and they need to know that even in those moments that you love them, you support them, and you're there for them as they start to build back that trust if trust was broken.
But it's hard. There's a fine line between, because when I hear leniency, I think of patience, and I think of navigating through those teenage years, which are bumpy and full of bad decisions, right? But then there's a fine line between that and enabling. So I think don't be too hard on yourself. As long as generally speaking, you're parenting from those values that I was talking about and generally aligning with those, you'll make mistakes. But generally, you'll kind of stay on the right course if that's what's guiding you, because that's hard. It's hard to know always whether you're being patient and lenient or whether you're enabling something that could grow into a larger problem.
Thank you. Anybody else?
Hi, you had mentioned something about anxiety groups at school. What is that? I've never even heard of it. And the counselors know my kids are dealing with high anxiety.
So I think it's on the website, but I'm not 100% sure. But you bring up a good point that I think we need to do a better job of sort of advertising the services and the things other than kind of the general, your student has a social worker, your student has a counselor, but kind of those things that we offer. Like I said, typically the way that we sort of identify students for these groups is either through, the student self-identifies, whether they come down to student services or, a teacher notices, and it just comes to our attention that way. Or parent, outreach, like I'm really struggling. I think that, my son or daughter is struggling. So those are the two primary ways that they would come to our attention, and then we would begin that process of, contacting parent and getting consent for the group, and going from there. But that's a really good question, and I think perhaps we do need to do a better job about advertising what we offer. So it's the structure of it is it's like 6 weeks long, and it rotates periods. And what I mean by that is, so 1 week it might be fourth, the next just so that the students aren't missing the same period every week. And we have a curriculum that it's run right now by our psychologists, and it teaches them coping skills and coping strategies with how to manage their anxiety. And what's cool about a group for teenagers, and it's not for everybody, But I think there's such a relief in hearing, like, I'm not alone, you know, that there's so many kids that are struggling, you know, just like me. And I think there's a great comfort from the get-go with seeing and hearing other kids' experiences. There's like 6 to 8. Yeah, we try to keep it no more than 10. So if, you know, if we're finding more need, we'll just add a group. Like I said, I think we're at 4 right now. And I think we'll probably be adding on to that.
Anything else? Any other questions? Okay. Thank you guys so much. I really appreciate you being here. It's exciting to be back, live, in person, and getting these conversations going because I know there's been a lot of questions, a lot of stuff going on in the past year and a half, and it's good to bring it all to the table. So thank you guys so much. Really appreciate it. Thank you.